Friend, I can tell you have a lot of community partners and that this plays a large role in your being able to both offer services in-house, which is, whenever that's possible, that's always ideal. Because then it's so accessible for people in your residential service and it's being delivered by, a person or a team that really understands domestic violence and all the ways that it intersects with everything else. But obviously, it's not always possible to do everything in-house. And that's where community partnerships are so important. So, how have you gone about cultivating those community partnerships and helping community partners to just be more aware of the realities that survivors face?
I'm going to start this one off, E, and I'll add
Sure.
on.
One of the things that we're really fortunate about here in terms of our relationship with the Forrester Center for Behavioral Health, which, as Brittany said, is our local substance use and addictions facility, their director of the medication assisted treatment program did her clinical internship with us here at Safe Homes. So she has a therapeutic background in working with survivors of domestic and sexual violence. And so she brought that with her to the Forrester Center. And so she is able to do some training of their staff as far as, the dynamics of domestic violence and sexual violence, but also their center does a lot of cross training with us. We will have advocates and therapists go over there to do trainings for their staff and also to offer educations for some of their therapy groups that they have. And then their staff will come over here and do trainings for our staff as well. And so we have also a really good referral system for, like, they will refer clients for our shelter, and we will refer our shelter clients for their intensive outpatient program.
And just to add on to that, I'm just going to generalize it a little bit. We cultivate community resources by giving our residents a resource list. This usually comes from me or the victim advocates at the women's shelter. And that's for any medical needs they have, additional mental health assistance, and low income and or senior housing. This helps build their sense of direction and autonomy. And victim advocates and residents discuss the options that are available and how they can go about them. And those options that are chosen by the resident upon departure, they become comfortable and confident with the next steps in planning their future.
Yeah, so really offering those resources and helping to really honor survivor choices. So they're aware of different options and then they have the support to really make those choices and follow up on the things that they name as important. And then I'm also hearing that just the importance of that cross training and being able to develop a sense of community with those external providers as well.
Yeah.
Yeah, that's fantastic. I mean, it's so often we hear from different DV programs, we referred somebody and then, they didn't access a service that was trauma informed, or they didn't access, the person didn't understand that they missed an appointment because they were being stalked, right? And so you're building that foundation together so that you can really address those barriers and help people to have a safe and a positive experience with the other provider.
Yeah. We can kind of all weave together to make a safety net.